Good evening and welcome to our live stream. We are so glad you have decided to join us tonight for this mental health check-in. This presentation is for parents or anyone who is looking for information on psychosis and the symptoms. Please note that Serlyn and I are not wearing masks, and this is because we are separated by a physical barrier. If there are any questions, please feel free to write in the chat throughout the presentation, and your questions will be addressed at the end.
Hi, I'm Serlyn. I'm one of the nurses with the Early Psychosis Intervention Team. As nurses, we do medication and metabolic monitoring. So that's checking blood pressure, weights, waist circumference. And we work with clients to get their mental health at a place where they're able to identify and work towards their goals.
Hi, my name is Alison, and I'm the occupational therapist on the team. As an occupational therapist, I like to look at function and how we can get our clients to do the things they want to do. With this population, it's generally around school or work. I love working on this team because with early intervention, we often see our clients do really well and move forward from the program to achieve their goals. So these are some of the topics we will be discussing today. We are going to be answering the question, what is psychosis? We're going to be discussing what sorts of signs to look for. We'll be having a chat about substance use and psychosis, treatment for psychosis. We are going to talk about our early psychosis intervention service that is available here at Niagara region. And we're also going to talk about how to talk to your kids about psychosis.
So what is psychosis? It's a condition that affects the mind where people lose a sense of reality. It affects the way a person's brain processes information and can change somebody's thoughts and the way they view their surroundings. It usually first appears in somebody's late teens or early 20s. Some of the things to look for are hallucinations. So that's when people start to hear, feel, smell, see, or taste things that aren't actually there. So a common example of that is when people start to hear voices. It could be somebody's voice that they know or they don't know. It could be one voice or multiple voices. Something else is delusions, also known as false beliefs. It's a strong belief in something that isn't actually true. Something that we commonly see in our program are when people believe that they're being followed, monitored, or watched by the government, or that they're getting messages from the TV or the radio specifically geared towards them. And the other one is confused thinking or disorganization. So they might not be making sense in conversations. They could be moving from topic to topic, so it's really hard to understand and follow the conversation. And they have a hard time taking care of their basic needs, so hygiene or grooming.
Okay, so phases of psychosis. So there's 3 different phases of psychosis, as you can see on this graph here. So the first phase, or the prodromal phase, is where symptoms aren't really as obvious. So you might see some changes in your loved one's thoughts and behaviors. They might withdraw more, stop connecting with friends, experience difficulty with school or work, not engage in activities that they once might have enjoyed, so maybe not playing their sports anymore or hanging out with their friends. This is a really difficult stage to identify as being related to psychosis specifically, so treatment is not generally offered at this stage. So the acute phase, or the second phase, this is the phase of psychosis where you will notice some of the symptoms we described before, such as hallucinations or false beliefs. It's much easier to recognize and diagnose psychosis during this phase, and this is the phase where our program or hospital or physicians will typically provide treatment for. And then finally, the recovery phase, or the third phase. So this phase is after someone has received some initial treatment for psychosis, such as medication, and they start working on recovery goals, such as return to work or school, or just engagement in some of the things that were important to them. It's important to note that sometimes the symptoms from the second phase, such as hallucinations, hearing voices, go away completely, but sometimes they don't fully go away. And really this phase of recovery varies from person to person. So there are several factors which can increase someone's risk for developing psychosis. These can include a family history of mental illness. So if somebody in your family has a history of schizophrenia or bipolar disorder, substance use can increase your risk for psychosis, and we're going to be talking a little bit more about that further on in the presentation. But some substances can cause psychosis or make you more likely to develop psychosis. And stress can certainly make you at increased risk for psychosis, whether that be financial stress, school or work stress, relationship stress. And certainly we do know that a history of trauma can make you more likely to develop psychosis. Something else to note is that lack of sleep, or going for extended period of times without sleep or small amounts of sleep, has been something that has been linked to increased likelihood for developing psychosis. And lastly, sometimes a physical health complication or injury can make you more likely to develop psychosis. For example, traumatic brain injury, tumors, strokes, or other illnesses such as Parkinson's disease or dementia can sometimes lead to a psychosis.
As Alison mentioned, substance use can contribute to symptoms of psychosis, and substances can put a person at higher risk for developing psychosis. So this can include cannabis, cocaine, crystal meth, ecstasy, MDMA, and mushrooms. The earlier the person starts using substances and the more they use, so they will likely be at greater risk because their brain is still developing until our mid-20s. Also, using substances can lower the effectiveness of medications. The treatment for psychosis is medications and counseling. So the medications used to treat psychosis are called antipsychotics. It relieves the symptoms to help prevent another episode, and there are a lot of different antipsychotics that work really well to help people better focus on their goals. Counseling can be really useful and effective. Some of those things could be goal setting, coping with symptoms and stress, returning to work, school, or meaningful activities. We really see a difference in recovery time based on how long someone went without treatment. The earlier somebody gets treated, the quicker the recovery, much like most illnesses. That being said, recovery time does vary from person to person.
So as I mentioned before, we know that stress can contribute to someone experiencing an episode of psychosis. So what we're going to do now is actually show you a video which gives a really good explanation on how certain people might be more likely to experience psychosis than others.
Stress is a normal part of life. Effectively managing stress is important to feeling well and avoiding mental health problems. Stress overload is one of the factors that can trigger psychosis. We all have different capacities for stress in our lives. Think of this bucket as your capacity. Your bucket may be large or small. Everyone's is a different size based on their genetic and social backgrounds and events in their lives. See this faucet? It represents all the sources of stress in life: school, work, relationships, finances, moving your home, and so many more things. Stress results from positive experiences as well as negative ones. And nobody's life is stress-free. As long as your bucket can hold the amount of stress in your life, you're handling it all fine. It's when your bucket overflows that things can go wrong, so it's important to stop that from happening. Having a big bucket means you can tolerate lots of stress, or if it's small, you're more affected by stress. And while you can't change the size of your bucket, you can change the way you manage stress to reduce the flow, such as avoiding work overload or making time to relax. It's also important to have strategies for reducing stress so it won't overwhelm you. Positive ways of coping, like regular exercise, getting enough sleep, relaxing, sharing your feelings, or even medications prescribed by your doctor can help lower the level of stress in your bucket, like punching holes in it for the stress to drain out. It's also important to keep those holes from getting blocked. Using street drugs like marijuana or steady drugs, overusing alcohol, or not sleeping enough can be like putting corks into the holes. And sometimes, even without these stress factors, a person's stress vulnerability can be so great. In other words, their bucket is so small that even the ordinary stresses of day-to-day life can be too much. And when a person experiences more stress than his or her bucket can hold, psychosis can result. That's why it's important to recognize the signs of stress in yourself or someone you care about, and to take positive steps and measures that keep that stress from building up. The sooner, the better. Remember, your mind matters, and controlling stress is an important way you can protect your mental health along with your physical well-being.
So why is early intervention important? Well, we do know that research has shown that the earlier a person receives treatment, they're more likely to do well in their recovery. The less time someone is actively experiencing symptoms of psychosis, such as hallucinations or delusions, the sooner they're able to return to their meaningful activity and relationships. Research also tells us that early intervention reduces the risk of depression, suicide, substance use, or hospitalization. And we also know that if someone only has one episode of psychosis versus several, they are more likely to recover well. If a person has more than one or multiple episodes, it may take them longer to recover.
So the people who are treated at the early psychosis intervention program are from the ages of 14 to 35. They suspect that they're experiencing symptoms of psychosis or have been diagnosed with a first episode of psychosis and have been treated for psychosis with an antipsychotic medication for less than 6 months. And anybody could refer to our program, so yourself, family, friends, a community agency or a healthcare provider, a family doctor, a nurse practitioner can fill a referral online, which will be linked in the chat. And the family doctor or a nurse practitioner or healthcare provider can also fax in the referral to our program. For kids under the age of 14, you can visit the Pathstones Mental Health website, which is also linked in the chat, or call Contact Niagara at the number provided.
So an early psychosis intervention team is made up of a number of different workers. So we have social workers, registered nurses, an occupational therapist. We have a peer support worker who is someone with lived experience providing support. And we also have a couple of psychiatrists as well. So how do we help with early psychosis intervention? We provide strategies to set goals. We provide coping strategies. We help develop skills to manage symptoms, provide education, medication monitoring. We engage our clients in functional activities, whether that be taking care of themselves, leisure activities, work or school. And then lastly, psychiatric assessment and monitoring. So how do we talk to our kids about psychosis? An approach that has often been recommended, particularly when dealing with psychosis, has been the LEAP approach. And LEAP stands for Listen, Empathize, Agree, and Partner. And I'll be going into further detail on each of them. So the first is listen. So you really want to listen to what the person feels, wants, believes without commenting. So if you can reflect back an accurate understanding of their experiences, they may be more open to talking with you and more open to hearing what you have to say. So an example of this is if your loved one is telling you that they feel really frightened because they think someone is watching them, you can reflect back to them. So what I hear from you is that you feel as though when you are sitting at your desk, there are cameras watching you. So really just reflecting back to them what they're expressing to you. The next is to empathize with your loved one. So you want to empathize with all the reasons they have for not wanting to accept treatment, especially with any feelings related to false beliefs. So something to be of note is that if you are empathizing with how a false belief makes one feel, this is not the same as agreeing that the belief is true. So an example of this would be if your loved one is hesitant to see a doctor, you can express empathy to them. I can see how that would be frightening to want to talk to someone about your experiences. I know that when I need to talk to a doctor about a health concern, that can cause me anxiety. With respect to false beliefs, you could say something like, it must feel very frightening to feel as though you're constantly being watched or monitored. That would be very distressing. I remember one time when I had that feeling and it was very upsetting. So really wanting to empathize with their experience.
The next one is to agree. So look for a common ground and listen to what motivates somebody to change or to accept medication. So some things that might motivate someone to change is to stay out of the hospital, getting a job or an apartment. And something that motivates people to accept medication is for them to sleep better, feel less stressed, feel less scared, and feel more calm. So instead of making an observation or a statement about what happened, like see if you had taken your medication, you wouldn't have ended up in hospital, you can ask questions like, so what happened after you decided to stop taking your medication? Did the voices quiet down after you stopped? After you stopped taking medication, how long was it before you went to the hospital? Some more examples of that could be, I understand why you would want to stay out of the hospital. I know you were really happy to be discharged the last time you were there. That makes a lot of sense. Or I agree with you when you were on medications, you were sleeping a lot better and you didn't seem as worried all the time. And the next step is to partner. Once you know the areas where you can agree, you can form a partnership to achieve some shared goals. When you share some goals, you guys can work together. An example of this is if your loved one is motivated to go back to work, you can offer some support, like ask, what can I do to help? Whether it's providing transportation, sending encouraging text messages, helping with getting up early in the morning. Decide together how you can help your loved ones move forward in their recovery.
So for those who are interested in learning more about the LEAP approach, this TED Talk is very helpful and you can find a link in the chat. It's called I'm Not Sick, I Don't Need Help, and that's by Dr. Xavier Amador. If you really want to do a little bit more learning about the LEAP method, Dr. Amador also has a book with the same title, and that can be found at most participating bookstores. Additionally, if you're interested in some further learning, there is a free course through the Center for Addiction and Mental Health, which is CAMH, and that's out of Toronto. It's called Empowering Families Affected by Psychosis. This is a free course that can be taken by anyone, and we've also linked this course in the chat for you.
In terms of crisis services, Early Psychosis Intervention Program is not a crisis service, so if you or your loved one are in need of immediate help, please go to the nearest hospital or emergency department or call 911. Otherwise, you can contact COAST, who provides confidential support 24/7, or connect with one of the distress centers at the number provided in the chat.
Thank you so much for joining with us tonight. We really appreciate you being here. And we noticed that there's been some comments already made and questions in the chat, so we really appreciate those. Please feel free, if you do have any other questions you might have, add them into the chat and we will do our best to answer. So I think to start, there were a few questions that were submitted prior to the presentation, and we're going to go ahead and answer those. And once we've answered those, then we're going to move on to the questions that are in the chat as well.
One of the common questions that we're getting is, how long does somebody need to be on medication for? And generally, after somebody's experienced an episode of psychosis, the recommendation is to stay on medications for 18 to 24 months before they trial coming off the medications, and this allows for the best recovery. Depending on whether the psychosis is related to substance use or an underlying psychotic illness like schizophrenia, it's recommended that a person continue medication through their lifetime so they can move forward to achieving their goals. So some people can decide to just stay on medications because they'll just take a pill one day a week and not risk another episode of psychosis.
Okay, another question we received prior to the presentation, and one we get asked quite a bit, is can cannabis actually cause psychosis? So the short answer to that question is actually yes. We do see people who come into our program with a diagnosis of cannabis-induced psychosis. Generally, this is seen when someone starts using cannabis at a young age and has very frequent and heavy use. So starts young and uses it very regularly and a lot of it. So the best course of treatment for this is to stop using cannabis and take medications and treatments as prescribed. So there's another question, Serlyn.
Yeah, it's what if my loved one won't get help? If you have somebody that has a diagnosis of psychosis or exhibiting these symptoms and won't get help, our early psychosis intervention team does provide support to families. So we do run a family education group and a family support group. So if a family education, and also there's a family education group that Alison had mentioned earlier with the Center for Addictions and Mental Health. If your loved one is at risk of harming themselves or others, or they're not able to take care of themselves anymore, and they're willing to see a family doctor, the family doctor can complete what's called a Form 1 under the Mental Health Act to have somebody go to this hospital and assessed by the psychiatrist. If they're not wanting to see a family doctor, there is something called a Form 2, which is linked in the chat. You'll be required to fill out the form and bring it to the local Justice of Peace, and then they can sign off on it, and that will have the police take your loved one and bring them to the hospital for a psychiatric evaluation.
Okay, another question we received is how common is psychosis? And I think the answer is a bit surprising to a lot of people. Psychosis is a lot more common than we think, and it will actually affect 3 out of 100 individuals. So a lot more common than people might anticipate. And the last, another
question we have is, can a person who had psychosis have a normal life? And the answer is absolutely. We see people from our program move forward and work towards achieving their goals. So people take their medications as prescribed and engage in treatment with our team are the ones who tend to do really well. And then they move on to continue with school or getting a job.
Okay. And we also see there's been a number of questions, so thank you so much for adding these into the comments. So we're going to go through from the start, and maybe Serlyn, I'll have you answer this one. The first question is, how does one get a diagnosis?
So a physician is the one that makes a diagnosis for a mental illness. There are certain criteria for somebody to be diagnosed with something like schizophrenia, but psychosis is just some of the symptoms that we had mentioned before, so it can be diagnosed by a doctor. So that's whether it's a family doctor or an emergency room doctor or a psychiatrist. More specific diagnosis past psychosis does take more monitoring to really narrow down what the specific diagnosis is and what the cause of these symptoms are.
Yeah, so sometimes, we have somebody come into our program, and the program, typically we see people for up to 3 years, and it might take the length of that 3 years for us to really follow them and monitor them before our psychiatrist comes up with a firm diagnosis with that. So a comment from Matthew: we need more qualified psychiatrists for persons of all ages here in Niagara. Thank you, yes. Matthew. That is very correct. And something that we're very well aware of working in the mental health system. A question: are there any costs associated with your services? That's a great question. Thank you for asking that. No, so our program are all fully covered by OHIP. So as long as you have a health card, you are welcome to come to our program.
Another question is, can family members refer somebody over the age of 18? And yes, you can. Anybody from the age of 14 to 35, as we mentioned earlier, can be referred to our program.
And just again, so if you are a family member looking to refer an individual, you can go onto our website, and there's an online referral form that you can complete to have them referred to our program. I'm going to have you answer this one again, Serlyn. So are there any serious side effects associated with the medication that are likely to affect individuals, and what should I do if side effects happen? That's a great question. Thank you.
Yeah, there are side effects associated with these antipsychotics, and that's why, as I mentioned in the beginning, the nurses do metabolic monitoring. So with some of the antipsychotics, there is risk of weight gain. That's why we measure weight, blood pressure, and waist circumference. And if we notice that somebody is experiencing some of those things, then we start to either adjust medications or implement some healthy lifestyles to prevent heart disease, stroke, and diabetes. And it really depends on what side effects you're experiencing. We monitor our clients very closely and work closely with our psychiatrists to make sure that we're minimizing side effects. And if they are too intolerable for somebody, then we can switch to other ones. Like I mentioned, there's a lot of different antipsychotics, and sometimes it does take trying a few out to find the one that really works. But yeah, we've noticed that it works really well with our clients, and because we do monitor it so closely, people are able to manage the side effects if there are any.
Yeah, I'd say it's a process that our team works really closely with the individual and our psychiatrist just to kind of monitor the side effects. And there's always, options that can be discussed around the side effects and other choices for medication, for sure.
So then, and also, like they asked, what can I do if I am experiencing side effects? So talk to your doctor, whether that's a family doctor or your psychiatrist or the worker that you have, to kind of work around these side effects and try to figure out how to treat them.
Just see if there's any more questions. Thank you so much. This is a really good question here too. What happens if I decide not to have antipsychotic medication? And we do see this in our program, right? You make your own choices around medication and treatment. So if someone decides not to have antipsychotic medication, then I guess it's learning to have coping strategies and manage the symptoms of psychosis ongoing without the medication. Is there anything you wanted to add to that, Serlyn?
Yeah, so our program is a voluntary program. So our psychiatrists and our clinicians try to work closely with the client to kind of develop shared goals. And if somebody doesn't want to take antipsychotics, then we just monitor them closely, their symptoms closely, to try to make sure that we're managing it in other methods.
Yeah, I think it comes down to kind of weighing the costs and the benefits associated with taking medication versus not, and really kind of figuring that out alongside your team. This is a really great question. Wow, do Niagara patients need to travel long distances for treatment? Are services available online or nearby? Excellent question. Something that's a bit unique to our program is that we do offer service throughout Niagara. And with the pandemic starting, over a year ago, we did do a transition to offering virtual care as well. And we have availability to do in-person care, but also virtual care. So it's really a client decision what their preference is. Now that things are starting to open up a little bit more, we are offering a little bit more community work too. So if someone really is struggling to come into the office and doesn't have access to virtual care, then we can make arrangements to meet people in the community as well. So we really try to be flexible because we recognize living in Niagara, transportation can certainly be a challenge.
Yeah, so pre-COVID we were doing outreach and community visits, and we are still doing that now, but we're finding some people do prefer the virtual, and we are also offering over-the-phone appointments, and this extends to, like, the over-the-phone and virtual appointments extend to our psychiatrists as well. So they'll see people on the screen or just talk to them over the phone, because we recognize that it is difficult to transport people to our office if they're living quite a ways away. So yeah.
So I'm not sure if there are any more questions, but really appreciate all the engagement with this, and just shows that people are interested and want to hear about our program and about psychosis. So it doesn't look like there's any more. So with that, I think we'll sign off. Please, if you do have any more questions, oh, one more. Okay, we have one more coming in. Oh, maybe not. No, there's no more. Okay, so please feel free to go onto our website, Niagara Region Mental Health. That's where you can, and that's in the chat, that's where you can access the referral forms and find out a little bit more about our program. So thank you so much for joining us. We really appreciate it, and we hope that has answered some questions and given you a bit of a further understanding of what psychosis is, what to look for, what treatment is available, and where you can go if you need some help. So thank you so much for joining us tonight.